WHO failed during COVID-19. Will it be able to handle the next global flu? What is the health crisis that is going on in Japan? Are our global health systems ready to manage it? And does WHO matter at the present time? Japan is facing one of its earliest and most intense flu outbreaks since last 2 decades. And this raises multiple important questions. That are global health system ready to face another pandemic? Do international forums still hold relevance in the present world? And is WHO actually ready to tackle this flu outbreak in front of us? Hello everyone, welcome to Vajiram and Ravi's Flash News. My name is Shubhangi Singh and today we are going to discuss the relevance of WHO, how capable is WHO and what made it go wrong, especially during COVID-19 with respect to the flu outbreak that we are seeing in Japan. So if we talk about this primary news that Japan as of now is on alert, and the reason for this alert is the flu outbreak in Japan. And this influenza epidemic is the earliest in the season as compared to last 2 decades. What do we mean by earliest? So basically whenever the flu outbreak used to happen or the numbers used to start increasing, it used to be usually after the end of October and November, but this time in the last week of September, Japan saw more than 4,000 cases, and in the first 10 days of October, this has gone beyond 7,500 as well. It is affecting health, it is affecting education, and it is affecting productivity of Japan. And we don't know when this epidemic can go ahead and become a big global situation just like COVID-19 did. Now, what is required to address such a situation? International cooperation, timely management and awareness itself. And in this very context, international forums such as WHO play a huge role. WHO recently conducted 78th session when we are talking for the Southeast Asia region, which is happening in Colombo. And the whole idea of such organizations and forums to come together is to tackle global issues, for example, health and fighting epidemics, pandemics is very much essential. So let us try to understand this in detail. Let us begin with understanding that what is going on at global level and how it needs to be tackled. So when we are talking about the 21st century world, we get to see that the nations, countries, states, they are very much interdependent on each other, be it for trade, be it for technology, be it for travel. But at the same time, there is a new rise that we have seen of fragmentation or what we can call as unilateralism. That means the voices for nationalism, that making America great again, focusing on one country and letting go of the global causes has been on rise. And when we are talking about two opposite thoughts, when we are talking about interdependence, but at the same time there is also fragmentation, how it is possible that we can come on a platform to tackle bigger issues? That only can be done once we facilitate a platform which transcends border and there is a proper collective global response to the challenges that lie in front of us. Challenges like pandemics, climate change, migration crisis, all of these are global level challenges, and even when we are isolated or we are talking about our own nations, at that very time, these challenges go beyond boundaries. So it is very much important that cooperation takes place, and that is the answer if we are asking, are international forums relevant today? They are relevant today, they are very much needed, because if we want to address the global challenges, we need people, we need countries to come together, to sit together, discuss and come up with solutions and also implement them. Now I hope this clearly answers that why do we need international forums? We need international forums so there is a proper platform for cooperation, there is a proper development of global norms, standards and agreements, and there is addressal of public goods at the global level as well, be it of health, be it of environment, be it of peace. And that is why we have multiple international forums existing, be it UN, be it WHO, be it WTO, be it IPCC. Now, can you tell me in the comment section other international forums and what are the global challenges that they are addressing? Now, in the context of international forums, the one we will be discussing in detail will be WHO, World Health Organization, which is solving the problem, challenges associated with the global public good, that is health itself. Now, when we are talking about WHO was established in 1948 and it is headquartered in Geneva. At present, it has 194 member states and with a clear mandate that attainment by all peoples of the highest level of health. So, the focus is on health, and that is not for a specific country but across the globe itself. And in order to deliver that, they have assigned core functions, which includes disease surveillance, outbreak management, setting global health standards, coordinating R&D, vaccine policy. If I am talking about global health standards, for example, it marks the number of doctors or number of psychiatrists which are required per 1,000 population, that is for psychiatrists. Then these recommendations are given by WHO, and it is also responsible for providing technical as well as emergency support which is required by member states. And WHO has been continuously working on this, and the Colombo session that we were talking in the start itself is a primary example that how the engagement by WTO is continuous and gradually we have evolved. This clearly shows that we have evolved from post-pandemic control to focusing on overall health. Now we are not firefighting the situation anymore, because if you see the focus area of this particular session, it has been healthy aging, tobacco control, AMR and regional emergency fund expansion as well. This is a clear example of proactive health governance where WHO is trying to build resilient systems which will stand firmly when we are talking about emergency situations or epidemics or pandemics. And this is basically WHO learning from the past, because if we talk about COVID-19, that is when we saw WHO failing, especially when we are talking about the core functions it serves. So when we are talking about WHO not being able to stand up to the mark it had set, let us understand the reasons behind it. The major reasons, if we look at it, the first was the delayed declaration of pandemic. When pandemic happened, WHO declared it a pandemic after 11th of March in 2020, and by that time there were multiple cases and that they were present across the globe. It was not only in a nation, across the globe. Another thing we saw that there was a perceived bias towards China. There were many excuses that WHO was soft peddling initial Chinese reports as well. And then we saw other limitations as well from the end of WHO, where they do not have any sort of enforcement power. They can only urge the member nation, they cannot push them to do it or they cannot control them. They only can recommend in these situations. Furthermore, WHO is highly dependent in terms of funding. 80% of funds, they are voluntary contributions. That means they are earmarked by donors and WHO is dependent on it, and that can affect the biasness as well. And another thing that we saw was that global north-south divide by WHO, because the vaccine access showed a structural bias in the system by WHO. But after the failure itself, we also need to understand that these criticism and limitation, they point towards the need to reform. Not loss of relevance. If we had loss of relevance, then they wouldn't have existed in the very same place. They have existed because of their relevance. The only problem that we are seeing are the limitations, and these limitations need to be addressed via reforms in the coming time, which can only be done with international cooperation, and that will come when we have international forums where countries, states, nations can come together and take decisions. Now moving on to understand that why WHO still matters, because it is a global coordination platform. It still gets to bring 194 members on the platform, and collective health actions can be taken. WHO has the technical expertise, that means disease classification, vaccine guidelines, lab standards, all can be tackled at this global forum. Rapid response mechanisms are still present, and when we are talking about health diplomacy, it is a bridge between rival nations, especially when we are talking about crisis time, be it in Ukraine, be it in Gaza or Sudan. And it remains that agency which is responsible for global surveillance. It tracks all the emerging diseases and antibiotic resistance, as well as scientific research and solutions related to it. So this clearly tells us that international forums not only hold relevance, WHO only is looking towards reforms, and it still has a lot to deliver to the global community in itself. Now, what do you think about it? Let me know in the comment section. I am going to leave you with a practice question here. You can put your answers in the comment section. That was all from my side. Thank you so much.